The COVID-19 outbreak is affecting us all. This includes our emergency responders. We need your help to help us. This means using your best judgment when considering calling for an ambulance. Consider if your situation is truly an emergency. Is what you're facing a life-threatening situation? Some examples of this would include cardiac arrest, suspected stroke, a traumatic injury, difficulty breathing. If so, contact 911. If not, carefully consider your next steps. Ask yourself, do you have other means of transportation? Or perhaps, could this situation be handled at an urgent care facility? Remember, if you are showing symptoms of COVID-19, call your primary care physician or PCP. It's crucial that when calling 911 to report an emergency, you let us know all of your signs and symptoms. This way, first responders can take necessary precautions to protect themselves. If first responders become ill themselves, they cannot help their community. Calling for an ambulance is not just simply calling for a ride to a medical facility. For every ambulance call, it takes about an hour to treat and transport a patient and properly decontaminate the ambulance. If your situation is not life-threatening, the ambulance would be tied up and unavailable for someone whose situation may be a matter of life and death. Information about COVID-19 can be found at nh.gov/COVID-19. Follow guidelines put out by the Centers for Disease Control. Remember, practice good hygiene habits and social distancing. Treat symptoms at home and self-monitor. If a sick person's condition becomes life-threatening, then call 911. Emergency responders will always be there for the residents of New Hampshire. With this pandemic, responders and resources may be stretched to the limit. With your help, we can work together as partners to help us make sure we're able to respond when you need us the most. As a whole community, we have a joint responsibility to work together to keep New Hampshire safe.